came across this course on the internet. I'd also heard of people that had had good treatments here.
A friend of mine sent me the information by Facebook.
Yes, you know, I came here as a patient because I have a bad bone situation. My spine is not in very good health and I was having pain. So I came in here and I got treatment and I found a lot of relief. In fact, right now, I'm pain-free. And if you saw my MRIs, you would see that I have a lot of degeneration of the spine and things like that. So because of the effect it had on me, I decided to take a course and study acupuncture here.
Working on illnesses that we would never normally get to work on back at home, which is something that we see a lot of here.
The pulse taking of this course is very, very good, especially for the people who start to do acupuncture, because it's very, very simple and it's very direct and precise. So it's very easy to get this pulse taking and start to diagnose patients straight away.
When we're taking the pulse, we are trying to locate a sadist and masochists within the organs. And the purpose then of the origin treatment, which is what we do when somebody comes for the first time and they have a chronic problem, is to get rid of the sadist and to help strengthen the masochists. And this is a very different approach to what I learned back in England, but it works. I've seen it work in clinical practice.
The origin treatment itself, like the main part of the course, is very powerful, and I saw that it's working very well, and that's what I'm going to use in the future.
There was one medical doctor that came here who was very, very anxious and worried, was having terrible sleep, and was really thought that there was so many things wrong with him, and that he was almost, I would almost go as far as to say he was literally thinking that he was had serious illness, that something was seriously wrong with him. And within a few treatments of working David's way, we did the origin treatment, followed by something called the Daimai treatment, which is to help clean and clear the liver. And then something called the PC, pericardium treatment, which again is a system that's unique to David. And we also did something called auricular acupuncture on him with bleeding, pricking the points to bleed. Within literally a few treatments, he was like a different man coming to the clinic. Now that was amazing to see, such quick results so fast.
I also liked there's a sense of community here between the patients and the doctors and between the doctors, which is very appealing, you know. And also that it is it's free for the patients. I like that a lot. So a lot of people, Indian people, come here of all kinds, you know. There's a man who works around where I live, and he does garden work and things like that, and he had a problem and he came here and I treated him 2 or 3 times, and now he's perfectly okay, and he had to pay 20 rupees for the needles, you know, or something.
There was a woman with a necrosis in the leg. It was seemed really bad the first time she came. We did blood sucking, also electroacupuncture, and she had very big improvement. The leg was completely dark in the beginning, and it started to become like normal color. Also the pain was already gone. It was a big improvement.
Trauma treatment, where you can help people to overcome their traumas very quickly. And I treated 2 or 3 people for trauma, and with very good results. Emotional traumas, things that have been in your system for many, many years, you know, helped with that. And there is treatments that go very deep into your system and relieve you. So it's not just aches and pains, you know, it's deeper situations also. I liked his outlook on it, the way he presents it. It's different.
Yeah, the breathing is also a very, very cool part of the course, and this is what I will be doing for every patient from now on.
The breathing diagnosis is something that's unique to David, and this is a fantastic addition to all the tools that I have. This is not something that I learnt back at home. This is unique to David.
Yes, now that's another thing which is extremely interesting of how the way you breathe actually is the way you live.
A lot of people are not aware of the way that they breathe, and doing this, applying this technique allows people to understand where they're breathing from, because we should be using our diaphragm and we should be breathing from the lower part of our abdomen. And most people actually, it's amazing the variety of where they breathe from. A lot of people breathe from the chest because we live very busy, stressful lives, and it's very fast breathing. So this is a way for us to diagnose even deeper, to understand more about the person by observing the way they breathe and helping them to breathe more
Natural
from
acupuncture
the
is entirely something that David has understood and taught us. And that is the best part of it, the basis of it. It's different and it has a lot of interesting and deep qualities to it.
I think everything was flowing good between the people, the students. So I guess this is because David, the teacher, is doing a good job, driving all the people in this way. So we had really good time.
Well, I like the way that David just throws you into it. So it's like you have to learn. Actually, it helps. It helps you because and he's always there. So and he's very open. You can always go to him. You can always ask him a question. His feedback is always good and pleasant.
David allows all of the students to immediately start working on real patients, and he's always there at hand when you need him. And for me, already being an acupuncturist, what I liked about this course was I've kind of learned a new way of working as well. David's approach is different in certain ways than the way that I learned back at home, but they really work in clinical practice. And that was really amazing for me to see.
I don't have a clinic. I'm just starting to, but I will. I'm going to. Yeah, I'm going to open a clinic in the future. Yeah, thank you.
Okay. Yeah. Thanks.
Yeah, that's it. Thank you.
It was great.